I think that there is an awful lot that is very, very depressing out there. But on the other hand, having spent the last few weeks in Australia and been incredibly encouraged by the enthusiasm and the commitment of consumers and others in that country to actually deal with a situation that is fundamentally much worse than it is in most parts of the developed world. There is a total ban on vaping in the country. Obviously, there's people find ways around it, and there's all sorts of methods by which people obtain their products and such. But it's fascinating that despite the onslaught that they face, these people are still battling away, again, just to have the right to do something that is harmless, relatively harmless to them, and almost absolutely harmless to anybody else. And it's very encouraging to see that. And I'm sorry if I sound a little despondent, but when I think about things like what is going on in places like Hong Kong, for example, where it was anticipated that there was going to be some regulatory framework introduced in the place itself, but for the chief executive to just take a unilateral decision that in a plan for the year that this was going to be banned, and within 3 months we've actually got legislation going through the legislative council there to start implementing the most draconian of regulations, including putting people in prison for using e-cigs. I mean, this is absolute madness.
Sorry, I'm going to need you to just repeat that. Is this in Australia? Where is this?
In Hong Kong.
In Hong Kong.
The Hong Kong Legislative Council is currently looking at measures which will make vaping in public places illegal. It will make the selling of vaping equipment illegal. And I think, as I understand it, it will make the possession of vaping equipment illegal. And there are potentially prison sentences threatened to people who are, again, as I say, doing something which is relatively harmless to themselves and certainly harmless to other people, and manifestly safer than the alternatives. Yeah. And I think that, we in the UK, I have to stress, I am not a vapor. I'm not a smoker. I'm an ex-smoker. I've never been a vapor. I've never used any other form of nicotine other than cigarettes and cigars. But I am astonished at how the evidence is piling up in the UK and how, it's not the best regulatory framework that we could wish for, but it's a damn sight better than anywhere else in the world. And we have a fairly mature and developing vaping industry here, which has got a very, very responsible attitude to the way it develops, produces, distributes and markets its products. And people can see that, if you look at the data, smoking rates have dropped. Okay, you can't make any causal link because there hasn't been any research done to make a causal link, but it's an incredible coincidence if smoking rates drop by 5% and vaping has increased by, to a level now where there's nearly 3 million vapors in the country. But we still, all we hear is, yes, but, nicotine is a cancer-causing chemical. Nicotine contributes to coronary heart disease. Apparently, nicotine has a serious impact on pregnant women, according to the Daily Mail yesterday. It's all unscientific, based on junk science. It's lazy journalism. It's people repeating and reproducing press releases that they receive and topping and tailing it and calling it news. And I'm sorry, but that's not acceptable. So, and I think that contributes to, if I am morose, that's what contributes to my moroseness.
Sure. When it comes to media and public health, it's an interesting relationship because it doesn't matter kind of who's in charge in government. So whether it's left or right, the mainstream media has almost always taken whatever public health has told them for verbatim. That's why the joke is, 1 year eggs are good for you, 2 years later they're bad. 1 year beer's good for you, 10 years later it's bad. And same, with red meat and everything else and red wine. And there's a joke, there's a laugh. I remember when I was in mainstream media, there's always a little laugh that you have. Well, they tell us today that steak's not good for us anymore. But the fact of the matter is that that's an indication, that's an actual visual indication where they're acknowledging that we just tell people whatever public health tells us. And so this is biting them in the butt, I think. And so they're ill prepared to be critical now because the mainstream media is captured by the progressive ideology.
I think public health has a place, don't get me wrong. I'm not anti-public health. But I think it has a place, but it doesn't know its place. That's the problem. When you referred before, to the pioneering work of people like John Snow around cholera in the 19th century in the UK, and other people who've done similar work around epidemics and pandemics, I think that's where public health has a massive role to play. It has a role in coordinating a community's response to a crisis. It has a role to ensure that medication is available to deal with those kind of crises and infections and diseases. What it doesn't actually have a role in my opinion, in my humble opinion, is people's lifestyle choices. And I think that that's where they get it very, very wrong. And that's where the anger and frustration amongst consumers and consumer advocates comes in. And that's where the debate then becomes, it becomes trading blows from one side to the other, rather than a rational debate examining the science. I've been as guilty of it as anybody else, and I've resorted to personal attacks and ad hominem attacks on people when I probably should have known better. But when I see the disdain and contempt with which certain figures, and they know who they are in public health, hold the consumer, then I am absolutely appalled. These people are public servants, and they should be doing something that serves the public good, not poking the public with a stick to provoke them.
Now, isn't there an understanding, I think, amongst commentators like myself, that public health, authoritarian natured people, aren't they attracted? I don't want to beat up on public health either, because of course they do so much. But in this particular case, they're not. And so we have to hold them to account because it's getting worse, not better. And so I'd like to point out that people who like to tell other people how to live their lives, people who like to tell people what to do, may be attracted to this particular profession.
I think that's possibly true. I work with a lot of people across the spectrum of public health, consumers, stop smoking practitioners, the media, all sorts of people. And I found some incredibly gifted and incredibly committed people working in public health for the public good. There are huge numbers of researchers doing fantastic work. If you look at the work that people like Peter Hayek does in the UK, if you look at the work that people like Manoa Glover is doing in New Zealand, and you look at the work that people like Colin Mendelsohn as a stop smoking practitioner is doing in Australia, you look at all of those people, leaders in the field, and you look at some of the young and upcoming researchers who are actually looking impartially impartially at the whole issue, and trying to make a judgment as to whether certain things are good, bad, or indifferent. And then you look at other people whose whole construct of the world is challenged by this new kid on the block. And they are the ones, unfortunately, sitting in positions of power who have a vested interest in things not changing. They also have a significant and possibly disproportionate influence on the careers of people who are prepared to stick their neck out and say things that are controversial. And I think, there has to be a middle ground here. There has to be a way out for some of these people, perhaps to say, maybe we got it wrong. But there also has to be a willingness for them to actually confront the science and not confront the individuals. Or, I'm subject to all sorts. I'm not a scientist. I'm not very many things, actually. I'm just somebody with opinions. But I am subject to censure and negative comments from people. Personal comments about, who do you work for, what do you do, all that sort of thing. And quite frankly, that's not what we need to be discussing. We need to be discussing what the science and the evidence are telling us.
So, and that indeed is kind of the case, is that they will attack based on where you get your funding and everything else. Meanwhile, all of their funding, you don't get, obviously it's biased because it's all funded by the government, right?
Well, yeah, and to be perfectly honest, Brent, until we actually have hypothecated taxes, they are receiving money from taxation that's been levied on these products and on alcohol and on all sorts of other things that are declared to be verboten, evil, the devil's brew, whatever they want to call it. And I think that, people have been called out on that. But I don't think that kind of level of debate is very helpful. I think there's a number of people.
Well, the one point about that, Paddy, I'd like to just bring up is because why I think it's important from our end to do that is that, at least in the U.S., the whole reason why the income tax came in was really the push by the temperance movement to extract government revenue coming from alcohol sales. Because up until that time, the alcohol industry was responsible for something almost like 60% of all government revenue in the U.S. So the temperance movement knew to get prohibition in and to work, they had to extract government from reliance on the alcohol money. Now we have an entire tobacco control industry that is relying on the taxes that are coming from tobacco sales through the master settlement agreement, right? And so to what you're saying is that we really do need to kind of highlight that and find a way to make that stick as opposed to pointing fingers, because really in the way, the analogy is exactly the same as what the original temperance movement did to get rid of alcohol.
Yeah, I mean, as I said before, I think people have vested interests and they have interests in maintaining, everybody needs to have a bogeyman. And at the present moment, the bogeyman is the tobacco industry. And all I would say is watch out, sugar, because you're next. I mean, you're right, there is an industry that is dependent on having something to oppose. But I don't think that's the majority of people. I think that I think it's a minority. Unfortunately, I think it's a minority with a disproportionate level of influence rather. And I think that what we need to do is that we need to encourage and embolden the more progressive, probably younger members of the public health community. Firstly, the first thing that they should do, and the one thing that most people fail to do, is actually talk to the public. Put the public back in public health. That's all that needs to be done. They need to take notice of what people are telling them. They need to come away from from looking at abstract data, and they need to start talking to people. There are a number of people in the UK that I know who have done that, and they're people who have earned the trust and the respect of consumers. And if those people were to say something negative about the products, people would listen to them. And the reason they'd listen to them is because they've been listened to previously themselves. And it's a two-way street, this. You cannot... It's a bit like public health has to develop a much better bedside manner, shall we say. It's exactly the same as happened with doctors who are general practitioners and hospital doctors. One of the things that was focused on in the 60s, 70s and 80s in medical training was humanising doctors, was actually having doctors listen to their patients and not tell them what you need, my young lad, is this. And as somebody who experienced that from doctors at a young age, then I appreciate that now you go and have a conversation and it's a partnership arrangement. It's not, I know what's good for you. And I think that's one of the temptations I'm going to get into all sorts of trouble for saying these things, I'm sure, but one of the temptations of people in positions of power is to just say, do as I do, do as I say, not as I do. And they need to come down and talk to people and just get an impression of what it's like on the front line. We just had 2 incredible events in Australia as part of the global state of tobacco harm reduction roadshows, as we're calling them. And during those sessions, we had scientists, we had politicians, we had consumers talking about their experience and talking about the issues that were raised in the report. And it was interesting that the audience was most gripped by the consumer experience. And that's largely because they've never heard it before, because they're never given a listen. I mean, I think in the media now, particularly in the UK, I can speak from experience here, there is a good line into the media, particularly on TV and on the radio, for consumers and also for practitioners who are much more open-minded in terms, for example, stop smoking practitioners who are much more open-minded about having the full toolkit, including vaping products, snus, and all sorts of other things available to them to use in their day-to-day work. And, you know, that's been developed because we've cultivated that relationship by being reasonable, responsible, and rational human beings. Now, I think that's also true to an extent in Australia, because from what I see, the media is quite, it's a bit of a chameleon, but in a lot of cases, the consumer advocates and people who represent the Australian Tobacco Harm Reduction Association are now getting a fair shake on the media. They're now getting a fair shake in the written media and on TV and radio programs, and the message is getting across. They're still coming up against the intransigence of the public health hierarchy, but politicians are now beginning to take notice. There is definitely a radical shift in politics generally in Australia and in New Zealand. Sadly, New Zealand has got other things on its mind at the present moment, but there is an appetite for change, but there's also still a fear because some of the people, the leaders in public health, are still fomenting this whole, oh, nicotine's dangerous, you know, nicotine causes cancer. Nicotine, I don't know what nicotine's going to do next. But Jeez. It's kind of there's a certain subtle change in the public mood, in the mood music, if you like, in the country, and I hope that we can build on that. I hope that we can help people locally to build on that. We have a role to play.
In Australia, though, and correct me if I'm wrong, things are pretty bad, though. The government has done some censorship of actual websites, not just social media. Is that correct?
I understand. I've not experienced that, and I have no first-hand knowledge of it, but I have been told of it. And if they are doing that, then that's despicable. I mean, the big problem that they have in Australia at the moment is the federal health minister, who's happily will not be there for much longer. But some of the states, I mean, we had a very, very good hearing from a number of politicians in Victoria, for example, in the state parliament in Victoria. And I visited there on a number of occasions, and we'll be going back again and discussing things further. But it's a long haul, and you've got to be resilient, and you've got to be robust in taking it on the chin from some of these people and giving as good as you get, really. Right. And we've armed ourselves with information and data through the Global State Report, which we intend to use. We will also be producing another 2 editions of that, one in 2020, one in 2022. Alongside that, we'll be producing a number of thematic reports, which will look at different aspects of nicotine. And these things and the website as well is actually a live website where there's real-time information, and the information is updated regularly. What we want to do is we want to provide information all the time that can challenge all of the nonsense that you see coming out of certain institutions. I mean, I think, you know, some of it is absolutely bizarre. I don't know if you saw Michael Siegel's commentary the other day, which he entitled 11 Million Lies the Tobacco Control Movement is Committing Public Health Malpractice by Misrepresenting the Health Effects of Vaping. And in there, he actually names and shames 10 organisations. I was surprised to see some of them, the more prominent ones, were not on there. But, you know, for example, you've got South Dakota Department of Health made a statement to say vape is not safer than cigarettes. Hartford County Health Department, e-cigarettes are not safer than smoking tobacco. The Des Moines Children's Hospital, it's absolutely not safer than smoking. That is a fallacy that adolescents believe because it tastes good. All this sort of stuff is really, I mean, it's not far short of criminal what is going on in terms of what people are saying, and we need to be pushing back on this. There are a number of organisations that are doing this, and all power to them. The consumer organisations are becoming much more powerful, and they're becoming much more clued up as well. They're very, very keen and eager to interrogate and comment on papers and on science that's actually put forward. And I mean, I have to say, most of it is beyond me, but I'd actually trust them to know what they're talking about. They're the people experiencing it, and they're the people we need to listen to.
But that's the actual case, right? Is public health even wired, though, to get that kind of feedback? Aren't they kind of wired to exist above, like at the population level? They're not concerned at all much with individuals, right? That's not really how epidemiology works. So what connection they have to science isn't connected to the individual. What connection they have to policy making isn't connected to the individual. Their money is coming from a collective, from a port source of government, and their power is attached to keeping tobacco in its place. I don't know, like, how do you puncture it?
I think a large part of this, and I've always said this, and I've said this to most consumers and consumer groups and advocates that I know, the battle here is the battle for hearts and minds. It's not the battle for control of or control of public health or anything like that. What it is a battle for hearts and minds. And what you've got to do is just talking about vaping, you've got to sell vaping as something that's good for everybody. Now, I think that one of the big issues that needs to be addressed, and is addressed by a number of people, is the whole issue of etiquette, vaping etiquette. And that is to say, essentially, don't piss people off when you're vaping. And I, for one, I'm a great supporter of vaping, but I also am not somebody who likes to sit in a room where I can't breathe.
Right.
And I think considerate vaping and blowing clouds when it's appropriate and not blowing clouds when it's not appropriate are going to win over the hearts and minds of people. Because at the moment, I mean, a very unscientific approach.
Fair enough, Paddy. But let me interrupt you here because I want to make sure that I kind of go at the first part of this. And it's not really your fault or issue. It's about all of the blocks that have been created. So regardless of what it is that you want to communicate with regard to vaping, you can't. You can't communicate anything about the health effects in comparison to tobacco in Canada and the US. You cannot make comparisons between the products. So you can't talk about health benefits. You can't compare the two. So if what I don't want to do is put this in a position where our viewers are hearing you put it down on individual vapors that we just got to not blow big clouds. Because there's real problems here. Like you can't buy ads. You can't communicate. You have no channel into the media, and they put all those blocks up.
I'm certainly not seeking to put to blame vapors for anything. I'm certainly not seeking to make it an issue that's solely for individual vapors. What I'm saying is, in terms of winning over the hearts and minds argument.
But you can't do that unless you have access to mainstream communication.
I think I agree with you that it's not something that's going to happen overnight, but I do think that, for example, having more vape-friendly premises, having places where vapors are welcome, starts getting people used to the idea that this is a good idea. That's what I'm saying, and that's what I'm part of I'm involved with the New Nicotine Alliance, a consumer advocacy charity in the UK, and it's something that we've been working on. It's small steps. It's not going to be. We're not going to get the wholesale change that people would like to see overnight.
Well, and maybe it's different in Europe, but here
it is.
Here in Canada for sure. In my condo building, 36 stories, concrete, I own. All of a sudden, out of the blue, 6 months ago, Strata issues a thing. I can't vape legally in my own condo.
Jesus, ridiculous.
Right. And so that's it. So, I mean, if I can't even have a safe vaping space in the place where I live, right, how can we expect, anything else? I mean, it's tragic. Let me get back to, you sent a great article to me yesterday in kind of prep for this. And boy, right on the money. It was by, was it The American Interest? Is that it?
Ron Dworkin.
Yeah, Ron Dworkin. And it's the arrogance of public health advocacy. And I will make sure, actually, the article has already been curated to regulatorwatch.com. And no trigger warning needed because it's pro-vaping. A whole bunch of our viewers have just gone nuts because RegWatch is finally doing what we do for every single other issue, Paddy, and that's curate both sides of the argument. And oh my God, I've not heard the end of it for 3 weeks. We're a news organization for 3.5 years. We've only ever put pro-vaping stories, our original content on. And we need to have some semblance of balance if we're going to be arguing that there needs to be a common ground found. And so some people are upset because they see some of the anti-vaping content up on RegWatch. Maybe that says something. That's a social justice warrior reaction. So maybe there's SJWs on the inside on vaping and SJWs on the public health side, and that's the real problem. And everybody else is caught in the middle. I'll throw that to you. Here's a bomb for you. You take that.
Sorry?
I said there's a bomb, a hot potato to throw.
I'd come at this from a position where, at the present moment, I think the first thing we need to do is to cease hostilities and actually take stock. And if nothing else, at least find out what we all disagree on. because at the present moment, this is going round and round and round, and that doesn't work to anybody's advantage. As I say, I mean, I think that I read the stuff from Scott Gottlieb yesterday, and it's the kind of the death throes of his tenure as the director of the FDA, and you know, this is what I'm going to leave. This is a legacy, and this is what's going to happen. And I think that it's a bad situation. What we need to do is just stop the ride and let's all have a look and see what's going on. It's very frustrating because there's a lot of good evidence out there that needs to be examined. And okay, there are people who will dispute that evidence, but let's have the evidential dispute based on something that is scientific, rather than just a kind of crazy a crazy assault on the evidence. Let's have it assessed and evaluated by people who disagree if necessary, or by people who disagree definitely. And let's I see the feed now. It's it's a kind of I'm on a mission. Here's my mission. And it's really sad that somebody in his position does this, because he's ignored all of the evidence.
For the longest time, I thought maybe this was actually his people, but it really does feel like him.
Well, it's on a Sunday, so I doubt very much it was. I doubt very much it was the people at the FDA on a Sunday somehow, but it is just it's like a school project, but it's unfortunately got massive implications for people.
And he's been doing these Twitter storms now for a while.
I mean, it's the way people communicate, isn't it? And I also think that, there's consumer advocates who are equally as adept at using those kind of things. But what we need to have is face-to-face conversations so that people get to know each other as human beings rather than as imaginary beings. Because people have all kinds of fantasies about what people are like. And that is one of the reasons we established the Global Forum on Nicotine. The Global Forum is, if you like, we try to be the Switzerland of the vaping world, or the nicotine world, where people can come together. Everybody has the right to speak. Everybody has the right to take part. There's no restrictions whatsoever. And we still find it very difficult to get people from academic and public health backgrounds, although, as I say, we have got a very, very solid group who come and take part. And it's growing. It's growing slowly, though. And I don't see this being a quick win. I don't see this being a very quick turnaround. I mean, I have to say, one of the things that was really encouraging was to see that Aaron Biebert, who directed and produced A Billion Lives, has now, I don't know if you saw his crowdfunding effort to raise money for a new project he's doing, which is called You Don't Know Nicotine, which is to make another movie and actually looking at nicotine and potentially looking at its good and its bad effects, and looking at it impartially and in a reasonable way. And he reached his crowdfunding target very, very easily. And it shows that there are people out there with an interest in supporting, looking at this stuff. And we've been supporting Aaron in that. And Aaron is actually working with us at the Global Forum and is actually curating our film festival there, which he did for the first time last year. And I think it's fantastic that he's managed to raise his initial target. And he's got serious investors in the film industry interested in this topic. It's a very sexy topic for the media in some ways. I just wish that I wish that sometimes they'd pay attention to some of the less sensational aspects of it.
Right. Well, and you got to imagine, too, for the longest time, nicotine and artists and movie making and everything else went together.
Absolutely.
How they could
And
turn
I
their
think,
back on it. That's an interesting point is that I want to, I'm trying to get around is that in a way it's anti-artistic kind of a thing, right? Maybe the progressives that are really, buttoned up and not, they aren't the arty type. And maybe this is kind of the thing, one of the reasons why there's a bit of disgust for it.
I think, I mean, if we could get into the whole kind of discussion about the concept of pleasure and the
Wow.
philosophy of pleasure.
Please
And,
do. I think it's
you know,
important.
I mean, I don't know where I stand on all of this. I read all sorts of books as part of my degree and, um, different philosophers in their positions. But I suppose that my abiding view on all of this is that it's a kind of utilitarian view, I suppose, that people aren't doing any harm to anybody else, leave them alone. And, people make their own choices. What I would say that I would be very, very worried about is if people were making those choices in splendid isolation without adequate information to do so. But I also think that people are not getting the adequate information. They're not getting both sides of the story because most people are not going to get their information by subscribing to and reading erudite academic journals. What they're going to do is they're going to buy a tabloid or they're going to buy some form of newspaper or they're going to look on the internet. And what they need is they need to be getting honest and accurate information on which to base their decisions. And they're not getting that. They're getting sensational reporting on, of National Enquirer proportions at times on what they, on what is going to, what the journalist or the editor thinks is going to play well and get them a headline. And that's no way to conduct this. If people are going to be, free and easy to do whatever they want, they really do need to have basic information about safety and about if they want to push the limits, then that's up to them. But so long as they've been given accurate and honest information, I have no problem with what people do, so long as it's not harming anybody else.
Well, and isn't that actually kind of the point, is that we live in an era where people don't want to just let people do whatever they want to do? And it seems like almost in every corner, you're being told what you can and cannot do. And this is just one of them, albeit a very prominent one.
Well, I mean, it's the whole thing now when there's any kind of issue or, there's any kind of outrage and it's the old something must be done. And people always reach for the panic button rather than taking a step back and having calm reflection on what is actually going to be successful and have an impact. I mean, politicians are classic for it. And I mean, it's a classic example in the UK, which is not related to this, but is related to medicinal cannabis. Cannabis of any description, according to our Home Secretary 12 months ago, will never, ever be, it's not something I want to see legalised. It's not this, it's not that. We have two cases reported very close to one another in the media of two children suffering from horrendous epilepsy. And they were using cannabis oil. And the parents were going and purchasing this elsewhere in other countries. And it was having a very, very profound effect on these kids and enabling them to live ordinary and relatively ordinary and happy lives. And lo and behold, in a period of 24 hours, there's an order in council by the Home Secretary to say, yes, these things can be, this can be legalised. Not a problem. It still isn't because regulators haven't quite figured out how to regulate it yet. But the Home Secretary's had his moment in the sun and is seen to be the good guy. And there's still two families who can have this prescribed for them. And we've now got a service which is allowed to prescribe it. But it's a private health service, and people on public health, on not National Health Service, cannot get these things prescribed. And it's kind of, to me, that's a very, very bad way of doing things. What you need to do is you need to have a logical way of making policy. And that's an example where it wasn't logical, it was emotional. And it worked for two people, but didn't work for the rest of the country.
Let me ask you this, Paddy, as we're starting to wind up here. I want to make sure we get a couple of questions in about Canada. We've talked about it, but specifically, though, we had what was some pretty decent legislation that came in. Many stakeholders, some begrudgingly, others, were happy to see the stable framework come in with the TVPA. But the ink's not even dry yet on the legislation, and here we are under the auspices of the epidemic of this crisis with kids and youth use. There appears to be some danger with regard to maybe these regulations getting cracked open or some new kinds of regulations promulgated under the framework. The fact is that there was a stability that was promised with the legislation that 9 months later, it's anything but stable. What are your thoughts on that?
I think you're suffering to an extent from Contagion, from south of the 49th parallel. But I think this is an issue that's constantly going to be raised, and it's that they've created a narrative. There is absolutely no evidence of this being a gateway for youth smoking. They won't listen to that though, because their narrative is that the children must be protected at all costs, and that spills over into the discussions about the regulation of products generally, and it should not. It should not, absolutely should not. And I don't know how you can counter it other than to keep on putting forward the alternative view whenever and wherever it's possible to do so. I think it's interesting that in a reverse way, the gains that have been made in New Zealand appear to be being undermined at the present moment by certain individuals in Australia trying to intervene and have their say and tell the New Zealanders where they've got it absolutely wrong. And they're failing, but it's nonetheless an attempt to. It's a bit like destabilising a legitimate government. It's some people have an idea in mind that something is right, and they'll do anything to push that idea, and it's fundamentally very, very wrong. But the only way to you can't deal with it in its entirety. You've just got to deal with it in whatever form it's raised. You've got to oppose it. You've got to continue to put forward an alternative view, and that alternative view needs to be consistent and argued from an evidence base. I don't have an answer to it.
Yeah. Well, it's a bit tough. When are you going to be back in North America?
I don't know. I don't know if I'll be welcome. Let me put it this way. I have no plans at the present moment. My colleague, we had two teams sent out on missions recently. I went to Australia with the author of the Global State Report, and we did the road shows there. And my colleague Jerry and two of our other colleagues have been over the past week in Malawi and Kenya doing similar events. And we have plans to do events in other countries. We don't know exactly which those countries will be yet, but some will be in Asia. And we certainly do something in Central or South America. Whether we will be able to do anything in North America, I don't know at this moment. But again, we have plans to do another series of road shows over the next 3 or 4 years, where I think we've got to do another 12 or more. And obviously North America will come into that, and Canada certainly is a candidate.
Yeah, last year in the springtime, there was a bit of an issue with the thing that
just
you
a
put
little
together here in Vancouver.
Yes, we'd love to come
We
back
didn't get an
to.
opportunity to go into real detail there, and I know we're wanted to be sensitive to around Dr. Tyndall's, help and issues that he might have. In fact, actually, next week I'll be doing an interview with Dr. Tyndall on all of this kind of stuff. Oh, and by the way, Paddy, and just for our viewers that don't know this yet, but Health Canada has agreed to our request from RegWatch to go back to Ottawa and have a sit down with now the new Director General of the Tobacco Control Directorate, James Van Loon. We'll be doing that interview, all goes well, on April 10th. And we'll be able to take a lot of these issues directly to Health Canada and hopefully get some answers, get their feedback, and also help, to build some bridges with some of the concerns that vapors have and the industry has. And I think you don't need to be a vapor, I think, or believe to be very concerned about this kind of overreach by government and public health activists into the decisions that individuals make on what they can and cannot put in their body.
I mean, again, you say not to go into too much detail because we do have issues ongoing with this whole issue from last year, but it was a good illustration where there was quite a number of open-minded and interested individuals who wanted to engage in an honest dialogue with the various stakeholders in this whole debate. And there were, I think, 3 or 4 people who made that not happen.
Right.
And I talk about disproportionate levels of influence and, shall we say, economy of truth, it's unfortunate.
I can tell you from covering what was the scaled down event, the more private event there, I can tell you that I could see why they wanted that to be stopped. Because, for instance, there was a Penny, can't remember her name. She was a public health worker that wasn't really tied directly to tobacco control or vaping or anything. And she was there, and great interview we did with her. Yeah. It was fantastic. Yeah. And she was so excited because 2 years ago, she knew only what mainstream media was telling her about vaping. A year, from that, she was working with the hospital, and they've got, the issue of all the, smokers having to get kicked out of the hospital while they're, having their stay just to go on the outside to have a vape or a smoke. And she couldn't understand it. And then she did a bunch of research on her own and came of the mind that, hey, wow, this vaping is a really important thing. And so that event was, a very strategic event for her, and we were able to talk to her and get that input. If that event wasn't happening, you wouldn't be bringing those kinds of people together within public health that are of becoming of a like mind on the side that is pro-vaping. And so they want to shut down all those opportunities.
But I think, we will continue to do what we can do to promote debate. I have to say, I don't have answers. I don't pretend to have answers, and neither do any of my colleagues. What we do is we put the information out there for people to look at and come to their own conclusions. It's not rocket science. It's just it's an open and honest, transparent approach. That's what we call for, and that's what we actually try to provide. That's cost us. That's cost us dear. And, we nearly lost that event last year. And I have to say, hats off to Mark, who was prepared to continue to work with us on that. And I think, at the end of the day, it was a success in that we got some of the messages across. And hopefully you got a few minutes of decent interviews from it. And I was grateful for that, because that was one way that we managed to get things out to a wider audience.
Yeah. No, it was really good. It was some of the best content we've done in a while. So, well, Paddy, look, I want to thank you very much for coming on RegWatch today and bearing with our technical problems at the start. Could you just? I
just hope you can edit this to make it sound sensible.
Yeah. Could you just tell everybody again where they can go to get more information on the Global Forum on nicotine?
On the Global Forum, I shall have to get the website up. Let me see.
I think I've had it in your key here the whole time, but why don't you just...
The global forum is gfn.net.co, and that will take you to the site where there is information about this year's event, plus there's a huge amount of information on there from previous conferences.
And that's in Poland, correct?
It's in Poland, in Warsaw, and it takes place from the 13th to the 15th of June.
And this is what year?
This year.
How many years? Sorry.
Oh, this is the 6th year.
6th year.
This
is got a huge reputation, and people talk about it in North America. Some go. I think more should. One of these days, hopefully, I'll get there too. Paddy, let me thank you again. Is there anything else?
There's a welcome there anytime you want to come, Brent, and you know that.
Awesome, Paddy. Well, look, thank you very much. For everybody, thank you for tuning in. And no big flash here. We're just going to fade to black. Once this is done, please share it around for us. And see you soon with more episodes in our series on the epidemic of fear. Thank you.